Hello, my name is Natalie Sweet, and I'm the program coordinator for the Abraham Lincoln Library and Museum in Harrogate, Tennessee.
Hi, and I'm Jake Wynn. I'm the Director of Interpretation at the National Museum of Civil War Medicine in Frederick, Maryland, and the Clara Barton Missing Soldiers Office Museum in Washington, D.C.
And this is Civil War Connect, a conversation between our two museums about Civil War medicine and the connections to today's COVID-19 pandemic. Now, a lot of our focus today is going to be on nurses. Today in the news, we're talking about our frontline heroes, and particularly nurses are on the front line, whether they are in hospitals, if they are connected to nursing homes. They're really out there putting themselves at risk. And the same was true for Civil War nurses as well. Not all of them made it to the battlefield. I believe we have a few, and Jake will maybe talk about her and her experiences with Miss Clara Barton. But other nurses were still going through the psychological impact of caring for dying and wounded men in Civil War era hospitals. And we might even get into a little bit of talk about what some of those hospitals looked like at the time, as certainly they didn't always have the sanitary conditions that we associate with hospitals today. So, Jake, I'll start out with asking you a question. If we look at social media today, there have been a lot of shout outs for medical workers during the coronavirus pandemic. Did the public recognize and celebrate the work of Civil War nurses too?
Eventually, yes. There definitely was a bit of a lag in terms of that happening during the Civil War. In the first year of the conflict, there were very few nurses who were women nurses who were going into the hospitals. That were being constructed. This is mostly because there was a belief that a woman's place was not anywhere near soldiers, near the armies, near wounded soldiers, and it became more of a manpower issue in the first year of the conflict, where the military authorities realized, why are we using able-bodied men as nurses when we have this supply of women who want to do this work, who can't be soldiers? And so you start to see by 1862 women coming into the hospitals, and they're almost immediately celebrated for their work. There is still a kind of lag in terms of there's still a belief in some segments of society that women nursing, the women who are doing that nursing work may be, of loose morals. They just want to be close to men. But as the war goes on and the conflict becomes bloodier, you do start to see more celebration of women nurses. And the soldiers themselves, they're the ones who really sing the praises of the nurses that they have in the hospitals, because they recognize that the healing touch of these women are literally a matter of life and death for them. And so you start to see them being, celebrated in diaries and letters. There's songs written about these nurses. And so as the conflict goes on, you do see these nurses being celebrated. And then after the war, there's going to be quite a bit written about the contributions of nurses during the war. But interestingly enough, not from the government's perspective. So like the medical and surgical history of the war, which is this very comprehensive book, series of books about Civil War medical care, has a handful of mentions of women nurses. So there was a lot of kind of anecdotal celebration, but no like official celebration of the work that they did and the vital part they played.
Yeah, and I think in a way too, some of the nurses created their own histories and their own celebrations of the work they did, although I think they would argue they certainly didn't see the books that they wrote post-Civil War as being a celebration of themselves, but of the lives of the soldiers that they affected. In our collection at at Abraham Lincoln Library Museum, we actually have the diary of Julia Wheelock, a nurse from Michigan who's actually in the Michigan Women's Hall of Fame at the moment because of her work with soldiers in Alexandria and around D.C. And in 1870, following the war, she actually wrote a book called The Boys in White that told about her experiences of caring for those soldiers. And to go back with some women had that tag put to them that maybe they were women of loose morals. A woman could also, avoid that if she went as a missionary, which is basically the mantle that Julia Wheelock ended up taking on. She became a nurse not so much because she just wanted to go to the front lines and be there. Her brother Orville had actually been injured in battle in 1862, and unfortunately, before Julia could find him upon traveling to the Alexandria, D.C. area, she learned that he had died. But she was so taken with the care that had been given by a nurse who attended him and who had stayed with him holding his hand throughout his final hours that she decided that was the missionary work that she wanted to do. So she stayed in the city as a part of the Michigan Relief Society and particularly took care of men from Michigan. She wrote about those experiences in her book, but even before that, soldiers from Michigan really began writing back home and talking about this lady from Michigan who not only sat by their bedside, but another great piece that we have in our collection is that she collected the daguerreotypes that those soldiers had with them too, and they gave her photos of themselves and photos of their children, even if they died, because they wanted her and she wanted to remember them as well. So we have this great collection of these people that she cared for, and she went into fantastic detail in her diary about the care that she gave those soldiers too. And so much so that the soldiers started writing home about her as well, and she began to be known as the Florence Nightingale of Michigan. So that's an interesting look at one way. And like you said too, the notoriety for her, and she's still not terribly well known today, but within Michigan, she definitely gained a reputation and a celebration much later on in life.
Yeah, it's interesting that you bring up, Florence Nightingale and calling Julia Wheelock the Florence Nightingale of Michigan. Someone that's near and dear to our museum's heart is Clara Barton, and she was known as the Florence Nightingale of America. And so, I think it's important to state that, the idea, the concept that Civil War nurses are going to kind of fit into this idea of women nursing can be traced back to Florence Nightingale's work in the Crimean War in the 1850s. And so there is definitely a communication of what she did during that conflict back to the United States before and during the Civil War. And that's going to really shape kind of how society views these nurses and the role that they can play in the conflict zone.
Yeah, and I think one thing too that we really remember Florence Nightingale for was her organization too. So with that in mind, what sort of training were Civil War nurses getting? Was it an organized system or was it developing as it went along?
Yeah, there's really no system that exists as the war is beginning, and really through the conflict, there's not going to be much in the way of training. It's going to be really these nurses are going to be kind of thrown into the hospital situation and kind of left to learn on the job. And that goes back to the concept of nursing just simply didn't exist as we understand it today in 1861. There weren't pre-established hospitals as we know them. Nursing care, if given at all, was given in the home by family members. There weren't trained nurses per se in the United States. There's a handful of women who kind of fit into that role, who are going to be early proponents of nursing, of women nurses during the war. I'm thinking of specifically Dorothea Dix, who did a lot of work with reform in mental hospitals and mental institutions before the Civil War. But as the war goes on, there's going to be such a need that they're just going to kind of throw people at the situation, and people are going to either sink or swim in these nursing situations. And you see there's some great examples. You have Clara Barton, Julia Wheelock, who are going to thrive in that setting. Then you're going to have other nurses who simply can't cut it for one reason or another. Can't deal with the suffering, the homesickness that comes with nursing. And I know this is going to come up a bit later, but the diseases that they're going to be in close communication with. Thinking specifically of oh gosh, her name slipped my mind. Little Women. I'm looking at Louisa May Alcott. I'm looking at the bookshelf over here, and I can see Little Women. I should have referenced that right away. Louisa May Alcott nursed briefly here in Washington before she got really sick with typhoid fever. That is something that other nurses who were less famous than Louisa May Alcott also faced. So, you know, the concept of nursing as we know it today is not fully born out of the Civil War, but is really pushing modern medical practices towards where we would recognize them. So in the years after the war, there's going to be nursing schools established, and there's going to be a professionalization of nursing that didn't exist during the war, but the war helped to kind of usher in that era.
Yeah, and talking about the organization and kind of development as it goes along, not really having training. Going back to Julia Wheelock, one of the things that we see is, much like you said, she was not alone when she arrived to look for her brother. She had 3 other women with her who arrived, and they tried to help for a time period, and they couldn't handle it. One of those women was the widow of her brother, but Julia stayed and saw to the care, really learned by watching, by doing. She found women that she admired for their compassion and tried to replicate that in her own work. But what's interesting to watch with her as she goes on is that you do see her picking up lessons from the doctors that she's working with, from also women like Dorothea Dix and Clara Barton, who she met. And one thing she became really passionate about was the conditions of Civil War hospitals. At the time, the hospitals she was located at had been treated much more as this is your final destination, it's a place to die at. And one thing that Julia Wheelock really wanted to see changed was that she wanted the areas to be cleaned up more. She wanted bright colors. She wanted more air. There was this belief if they got in more fresh air, they would heal, because she saw the destination as the hospitals as not this place that one would eventually just kind of languish and then expire, but as a place where soldiers could truly heal. And we see her trying to take what she learns from women like Clara Barton and apply it to the area. And that also means then that she has to get into the hard work of fundraising too. So she writes back home to friends in Michigan, which brings us to another good question. Seeing that she's having to make these public appeals to the Michigan Relief Society, one big concern during our current COVID-19 outbreak has been that making sure nurses and other medical professionals have access to safety equipment. Was this a problem for Civil War nurses?
That's a great question. And the answer to it is not really, because there's very little understanding.
Sorry. That's lady.
Gotta get the barking in.
She feels very strongly about Civil War nurses. She has thoughts.
Me too. I actually think that she bears a striking resemblance to the way I talk. Yeah, nursing equipment. There really wasn't any. You know, it's important to remember that 155 years ago during the Civil War, there wasn't an understanding of germ theory. They didn't understand necessarily how disease was spread, how infections spread, but there was a focus on cleanliness. And so there was an emphasis on cleaning in hospitals, specifically cleaning bed sheets, cleaning the patient's clothing. Anything that comes into contact with the patient is going to be clean, and they're going to have open windows and fresh air. And so there is an emphasis on cleanliness, but there's no washing of hands. There's no wearing of masks. There's no protection for those nurses and for the doctors and other medical personnel who are also working there. And so that meant that they were particularly susceptible to some of the things that could be spread around in those hospitals. And this is why you end up with cases like Louisa May Alcott getting sick and other nurses like that getting sick, and in some cases dying of the illnesses that they get, because there simply wasn't protection for them. They didn't have the understanding, the knowledge, or the capability of protecting themselves from those hospital settings.
Yeah, and as you mentioned that Louisa May Alcott eventually caught typhoid as a result of her work. We see actually at the very end of the war, although it came much later, Julia Wheelock would also contract typhoid as well. And she then shifted her focus on going back to Michigan and then fundraising to continue to help soldiers post-war with some of the recuperation that they would need to continue to heal following the war's end. So she
Yeah.
shifted her work there. But with thinking of that and seeing that nurses like Louisa May Alcott get sick, that Julia Wheelock are sick, did the public ever recognize that nurses were putting themselves in harm's way? Was there any realization of that?
I mean, when say like a hometown nurse or somebody that was affiliated with, with a certain area went off and didn't come home, I mean, there was a recognition of sacrifice, that they were serving their nation in their own way, and trying to, do their part for the war effort. I would say though that there wasn't really a full recognition of the dangers that came with nursing. One of the ways that at points of evidence that I would suggest looking at is looking at pensions for nurses, which didn't come until significantly later, and then there's lots of fights over who was a nurse and who is eligible for a pension. And so there was kind of you had to really, if you were a nurse who say volunteered and you weren't officially on the books for nursing during the war, it was virtually impossible for you to get that recognition and get that little bit of money that would come in from the federal government to support you, because nurses faced disabilities as a result of their service during the war as well. You think of soldiers' disabilities, and you think of amputated limbs, and you think of bullet wounds and men torn apart. But a big part of the disability side for Civil War soldiers was disease and chronic illnesses and chronic conditions that started during the war. And some of the nurses got those things too, because nursing was hard work. Working in those hospital wards was brutal. And so they would face some long-standing implications because of that work, but oftentimes they didn't necessarily get the recognition, but they also didn't get the financial advantages that the soldiers got.
Yeah, we see that with Julia Wheelock as well. She never received during the war any payment from the federal government itself. However, the Michigan Relief Society, for which she then stepped forward as a volunteer, managed to organize and put enough money together to where she received $5 per week for pay for her work with the soldiers about midway through her service. And it wasn't until almost near the end of her life, she died in 1900, that she actually did receive a pension from the federal government for her time as a nurse. But again, she was a very prolific nurse. She had really done that fundraising that she did for the soldiers, also got her the visual recognition that she needed later on to be able to claim money for a pension for herself of $12 a month from the federal government. But like you said, a majority of nurses never got that. And part of the reason she gets to be so prolific is that she came from a fairly decently well-off family, that higher middle class status, that was able to be in touch with people requesting funds, that then gave her the visibility later on to be able to claim something like a pension and to apply for it and to be given it by the federal government. But so many nurses did not, as you note.
Yeah. I'll just mention, I'll just add in that we have a collection, a fantastic collection of letters from a nurse in our collection. Her name was Clara Jones, and she was a volunteer nurse, started volunteering. She was a school teacher near Philadelphia, and during her summer vacations, she would go and breaks from school, she would go and volunteer as a nurse, and was there after Gettysburg in 1863. But because she was never officially a nurse, never officially signed on the dotted line for the federal government, she struggled for the rest of her life to get a pension and never got one. And so she was, that's a case of someone whose letters, whose documentation could show that she was in these hospitals helping these soldiers on this date, and even that wasn't enough evidence for her to get even that small amount of money from the federal government for her work. And she went, the rest of her life fighting for that, and never received it.
So it sounds like we've talked about the risk that nurses went through, the little, if any, pay that they received for the work that they did. We see them holding soldiers' hands, helping with wounds. With that in mind, how did the responsibilities of Civil War nurses differ from those of doctors? How was what they did different from what the doctors were doing?
Yeah, so there's some great research that's been done about what the roles of nurses were during the war, and they really fit into basically, I mean, every task imaginable in a hospital, except for making decisions about what patients' care would be. They have no say in that whatsoever. They can become advocates for patients, trying to get them better care from doctors in these oftentimes crowded hospitals. But you see women. You know, they're changing those bed sheets, they're washing patients, they're feeding patients, they're making the food, they're cleaning the wards, they're keeping the stoves going. I mean, they're doing everything in to keep those hospitals running. But I think most famously, and the area that I find personally most interesting, is their interactions with patients. And so they become friends. As you mentioned about Julia Wheelock collecting photographs and kind of memories of the soldiers that she treated, they create these very personal relationships with their patients, and they feel very strongly for them. And I think one of the most compelling things to me, at least, and I think would probably wager that it's many of the viewers as well, is the role that they had as surrogate letter writers for those who either couldn't write letters, were too weak to write letters, or were recovering from things like amputations, and the role that they have of being a correspondent for those patients and writing home for them, and you know, trying to be an advocate for those patients. I think that's they oftentimes are they're the personal connection to the patients. You know, the doctors oftentimes they're dealing with, you know, beds here in Washington D.C. They have hospitals with 10,000 beds. That's 10,000 patients that they have to manage, and they're trying to get those men back out to the front lines. And so sometimes is lost that personal connection. And those nurses, the soldiers themselves, talk about how they were, you know, human, and they were, you know, not always. There were some nurses that were hated, and feared and dreaded. But many of them fit into this role of being a personal, you know, just a good person to be there for somebody who's in dire need. And in some cases, it's going to be a surrogate, you know, for grief as well. If family members couldn't make it in time to see their loved ones in these hospitals die, they're going to fit into that role to be there and to be a witness and record last words, which was really important for those living in Victorian America. So they really do run, I mean, almost any role or responsibility in a hospital during the war. Nurses will oftentimes be doing those jobs, oftentimes thanklessly, except for ultimately deciding patients, you know, care and ultimately the outcomes for those patients.
Yeah, it's so interesting to think about the fact that these nurses were recording so many of those last thoughts, being those letter writers. We definitely see Julia Wheelock doing that. And with the current pandemic that we're having because of the nature of the disease, many people can't have their loved ones by them in their final moments. And the roles that these nurses are taking, stepping forward to try to connect the families on FaceTime or write down thoughts. They're really uh, carrying uh, added advocate and mental duties in addition to what they would typically do in that role. And it's an interesting thing to think about the similarities. Of course, there's this new technology added in that's allowing these families to record, but just that idea that uh, these families are separated by each other by a distance, and the inability by the disease to allow them to be near each other, and that these nurses are stepping in to make a connection in that void.
Yeah, one of those direct connections you can draw between the Civil War and right now is just that distance that people had for the first time during the Civil War, where many of these soldiers going off, it was the first time they ever left their hometown or their home county. Certainly, their first time they left their state. and went off to fight in a war hundreds of miles away and get sick, go in the hospital, get injured on the battlefield. And yeah, their families are so far away, and they have no way of, many of them have no way of getting to see that soldier before they ultimately passed away. And so those nurses fit into that role. And it's hard, because it's hard to imagine that 155 years later we have something that is, you can draw such a parallel to the Civil War. But I think you nailed it, Natalie. I mean, I think that nurses are filling in these roles again that they had 155 years ago during the Civil War. And I think it's important to remember the humanity of those nurses back in the Civil War, and they were very much unprepared for what they were going to face in those hospitals, all of the death that they experienced around them, the suffering. And I think that's something that we can take away now when we're trying to understand what nurses today are facing, and the doctors, the medical personnel, the scope of what they're facing, and ultimately the consequences of that, both in terms of physical, of course, being in close proximity to patients who are very sick, but also in terms of mental and emotional health as well. And I think we're going to be dealing with a kind of, among our medical personnel in this country, issues with mental health and emotional health. And certainly there's going to be some PTSD associated with this. And we'll need to be there for these amazing heroes, as you mentioned at the beginning, these heroes who were saving lives, who are saving lives during COVID-19. They're going to need help moving forward in the years to come. And I hope that, all of the things that I see, the, people clapping and hanging signs out their windows, thanking these people. I hope that in the years to come they'll continue to provide that kind of support, and I hope that there'll be, hopefully some financial stake in that too, because what they're doing right now, I don't think that they're being fairly compensated for the risks that they're putting on themselves, their families, and I think we're going to be dealing with the consequences of this for a long time to come.
I would agree with everything that you said, and it will be up to us as a society to push leaders who make those decisions too, into making certain that those healthcare workers are fairly compensated, and that they eventually have access to the resources that they need.
Yep.
To make certain that they have those mental health and emotional resources that they may need following this, and that we begin thinking in the future about curriculum and how to better prepare, if such a thing can exist, preparing for something like this.
If there's a lesson we can take away from all of this, I know there's many lessons we can learn from this. I think one of them that's relevant to our conversation moving forward is that nurses after the Civil War did not receive the recognition, the compensation that they deserved for all of the sacrifices that they did during the Civil War, and the lives that they saved and the lives they changed. And I think we can do better. And I think we can take the lessons from the Civil War and the aftermath and say that we want to do right by these people who have, again, put their lives on the line, the lives of their family members, to help others. So I really do think that that's one takeaway that I hope our viewers will come away with, that that these people are really heroes, and they deserve recognition for it, but they also deserve moving forward to be, have some assistance that they're going to desperately need.
Definitely. Don't wait 150 years to mark those individuals as heroes. The need, the care, it will then be our turn as a society to give the empathy and care that they are giving in this moment to them when we get to a point where that can be provided. So with that in mind, I think it would be safe to say that we dedicate this episode to our frontline healthcare heroes, all the people who are working in hospitals with our loved ones, in nursing homes, in cleaning these facilities, making certain that they are clean and are a safe place to be. We thank you so much for what you are doing to help our society. We see you, we appreciate you beyond anything that we can actually give back in return for what you're doing in this moment. So next week we will be chatting again about some angle of Civil War medicine. Again, viewers, I would encourage you, if you have anything you would like us to address in one of these sessions, we'd love to hear from you so that we can dig in together and really explore something that you are curious about. So make certain that you reach out to us in social media, Facebook comments. If you see us on Twitter, if you see us on YouTube, leave comments there. We're checking all of that, and we will tackle those questions. So until next time, I am Natalie Sweet at the Abraham Lincoln Library and Museum in Harrogate, Tennessee.
And I'm Jake Wynn with the National Museum of Civil War Medicine in Frederick, Maryland, and the Clara Barton Missing Soldiers Office Museum in Washington, D.C.
And this has been Civil War Connect. Thank you for joining us.
Bye.